In 2019, there were over 400,000 Nigerians with tuberculosis, but only a quarter of them were diagnosed and treated. The Shops Plus project, funded by USAID, has been working to change this situation by increasing access to TB care through the private sector.
A ni lokacin ma da aka gaya min ina tsaye da na zauna. Saboda da na zauna na yi tunanin yadda mai gida na yi mutu, ni ma mutuwa zan. Saboda ina tunanin shi ma ciwon ba shi da magani. Sai daga baya da shi doctor din ya ga na shiga damuwa. Sai ce Zainab kina tuna mai gidanki ko na ce ki yi haƙuri. Akwai maganin da in kin sha kin tsaya biki fashi ba za ki warke. Wata 6 ne. Ina nan za ki zo min da murna da dariya. Sai na ce to Allah ya yarda, yace amin.
We identified Zainab as a TB patient from a referral from a patent medicine store, which is part of the Shops Plus effort to increase TB awareness by involving those stores that the people in the community visit as a first point of contact.
Hajia Zainab Mohammed came into contact with my facility here because of some other people who have helped and they have been sick before and recover. That is why Zainab decided to come and meet me and said, I've been coughing and I heard that you have been helping people. Please, can you help me and direct me to the hospital where I can be treated? And I said, okay, since you are here now, I'm going to give you a sputum container for you and for the children. So after some days, the result came out that Zainab, the first son, and one of the daughter, Umi, were positive to TB. And then I escorted them personally to the hospital. I met the doctor on duty and I told them that these people look at their result and the doctor really attend to them and give them drugs.
To kuma alhamdulillahi na sha magani tsawon wata 6 kuma na ji sauki na warke. A wata 6 nan da na sha kaga dai shekara 3 wannan watan ba inda ike min ciwo a jikina.
If a patient presents with signs of maybe a pulmonary TB or some other TB, we order for a gene expert.
Using a PPM approach in Kano State have actually proven very useful. When we started the Shops Plus model in 2017, PPM contribution to overall TB case finding in the state was barely 3%. But as at 2020, we saw a jump in this figure and PPM contribution had risen to about 25%. Shops Plus had screened over 2.5 million people and have actually notified about 5,500 TB patients in the private sector. In Kano State, there are different kinds of private health sector actors. There are patent and proprietary medicine vendors, there are community pharmacies, there are standalone laboratories, there are clinical facilities which are hospitals, nursing homes, and even clinics. So with the Shops Plus model, we're able to actually bring all of these facilities together to collaborate in identifying presumptives. And how we do this is using a hub and spoke approach. So private facilities are used as the hubs and all of these other actors in the private health sector are used as spokes. So for example, if a client is identified at a PPNV store, the PPNV refers that client to a private facility.
If you look at the condition of health care in the country, there are some services that are not available in the government facilities or public facilities that you have to come down to the private sector to get them.
With the coming of Shops Plus project, our PPM engagement got improved significantly, and then the notification, because for whatever you do, the ultimate goal is to find, notify, and treat a TB patient, because that is when you break the chain of transmission, and then that's when you now say you have actually saved a human life.
The future of the private sector in PPM, as I foresee, is for the private sector to actually take the lead as being the #1 source of TB services in our community. After all, majority of Nigerians actually seek care through the private sector. This means that there should be a commensurate high level of service provision for TB by the private sector as well.